We need to act it today. We cannot wait for tomorrow.
Nobody can do this alone. Early action saves lives. Empowering our women is also a way forward.
Zero dose children should be a priority.
If we work together across boundaries, we know we could eliminate this cancer.
Getting zero is very possible.
Hi, and welcome to Getting to Zero, a series of conversations with global health leaders about getting to zero preventable deaths through vaccination and other measures. If you enjoy what you see and hear, please like and subscribe below. My name is Dr. Nginache Nampotankomba, and I won the Sabin Vaccine Institute Rising Star Award in 2021 for my work on typhoid in Malawi. I am now a PhD candidate in epidemiology focusing in vaccinology at the University of Maryland, and I am researching the impact of prenatal HIV exposure on vaccine-mediated immunity and growth. Today, I am talking with Dr. Matthew Lawrence, who is a professor and a pediatric infectious disease specialist with a primary research interest in malaria, typhoid fever, and other diseases that disproportionately affect people who live in low-resource settings. He conducts studies at the University of Maryland at the Center for Vaccine Development in Baltimore, but also at international sites in Burkina Faso, Mali, Malawi, and Uganda. Dr. Lawrence directs the Typhoid Vaccine Acceleration Consortium, which aims to accelerate the introductions of new typhoid conjugate vaccines as part of an integrated approach to reduce the burden of typhoid in countries eligible for support from Gavi, the Vaccine Alliance. Welcome, Dr. Lawrence. It's so good to have you on the show.
Thanks for having me. It's wonderful to be with you.
So let's start by setting the scene. Typhoid is a disease of poor sanitation and unsafe water. Despite decades of investments in water, sanitation, and hygiene interventions, it continues to burden many parts of the world. What is the current global burden of typhoid, and why does it persist at such high levels despite these efforts?
So the global burden of typhoid is estimated at about 7 million cases per year and around 100,000 deaths per year. And those are estimates because the burden of typhoid is incompletely captured for many reasons that I'm happy to discuss. But those are the current estimates that we have. We know that typhoid is common in areas of Asia as well as in sub-Saharan Africa. It was common in industrialized countries long ago, but it has since been relatively eliminated in those areas. We also know that provision of safe drinking water is the single most life-saving public health intervention that can be provided to communities. The reason why that hasn't happened is essentially a question of cost and infrastructure. It's very expensive to provide clean drinking water and establish hygiene protective measures in communities. And because many low middle income countries lack the resources to establish these systems, they are not able to have the clean and safe drinking water that many of us that are able to obtain in industrialized countries. This long-term investment, while is necessary in these areas that are hardest hit by typhoid, the only thing we can do in the interim is provide other protective measures such as vaccination that can prevent it against typhoid.
As you mentioned, there's still a lot of cases, over 7 million, like you said, and deaths happening annually. So why is typhoid so difficult to track? And do you think that if we had more reliable data, that would help raise its profile as a public health priority?
So typhoid is difficult to diagnose because it shares many of the signs and symptoms with other diseases common in areas where typhoid is endemic. For instance, malaria and dengue fever, they often share signs and symptoms of fever and fatigue and malaise. So it's difficult to diagnose just based on clinical symptoms alone. So to really diagnose typhoid, you need a blood culture positive specimen. And the issue is that in many areas where typhoid remains, blood culture capacity for diagnostics is quite limited, if it exists at all. In some countries, it might only exist in a single research laboratory. So making the diagnosis of typhoid is extremely difficult, and therefore estimating the entire burden of disease is even more difficult because most of the populations that are affected don't have access to that diagnostics. So what typically happens is a child or an individual presents with fever and feeling bad, and they might be treated for typhoid, or they might not be treated for typhoid and treated for something that may mimic typhoid, like malaria or like dengue fever. So it makes the diagnosis and tracking of typhoid very difficult.
Yeah, thank you for sharing that. It is truly indeed difficult to diagnose typhoid. So prevention is probably something we should focus on a lot more. So let's talk about that, particularly vaccines. So vaccines have transformed control strategies for most infectious diseases. How effective is the current typhoid conjugate vaccine? And what do we know about the protection's durability? And also, what's next in the pipeline for typhoid vaccines?
So the current typhoid conjugate vaccines have been tested in phase 3 studies in Bangladesh and in Malawi and in Nepal. And these initial studies looking at children 9 months of age and older show that TCV has an effectiveness of around 80%. And that effectiveness is extremely high for a conjugate vaccine, especially for a single dose vaccine that can be given and achieve high levels of protection. We know that from studies in Malawi, this protection lasts for 4 years, potentially longer. And studies are ongoing to determine exactly how long that protection lasts.
What is new or coming up in the pipeline for typhoid vaccines in the future?
In terms of what might be coming up for typhoid vaccines, the conjugate vaccines are being targeted to areas that are at highest risk for typhoid, including children, both school age and under the age of 5. So the question remains as how long this protection would last. So looking to see where a second dose of typhoid conjugate vaccine might be indicated. It's not currently indicated. Again, we don't know exactly how long that protection lasts. But are there areas or targeted populations that could benefit from a second typhoid conjugate vaccine dose? That's one piece that we're continuing to assess.
Even though there is an effective vaccine that's available, we know that access and equity remain uneven. Why have many countries not yet introduced typhoid conjugate vaccines into their national immunization programs? And how can the global health community ensure that the countries most burdened by typhoid are leading the way in vaccine delivery, research, and even innovation?
Two answers to your question. One is that some countries might not have a clear picture of the burden of typhoid in their region and in their country in particular. So that goes back to the issue with diagnostics. Many countries don't have the capacity for blood culture diagnostics. They might only see the very severe cases that only make it to the referral hospitals and don't know exactly the burden of typhoid at the community level. So this makes prioritization of typhoid difficult because many of the areas that are endemic for typhoid also are endemic for other diseases like dengue and malaria. And with other preventive measures that are also available, countries have to pick and decide which ones to prioritize. In addition, multiple vaccines are currently being introduced in many areas. These include vaccines that are newer, including for malaria, and other vaccines that haven't yet been introduced into certain areas like rotavirus or pneumococcus vaccines. So countries are faced with a very large vaccination schedule and very limited resources to conduct vaccination campaigns and routine immunizations. So strengthening the health structure of countries to deliver vaccines, to deliver basic health care is essential if we are to advance health and prevent death in pediatric populations and in communities globally. In addition, we need to continue to support research efforts to document how large the burden of disease is in these areas. In our country, in the US, we've seen significant cutbacks in terms of foreign aid and assistance to areas where typhoid is endemic. We need to bridge that gap and continue to provide resources to these areas so that they can achieve the health that every child deserves.
Thank you for those insights, Dr. Lawrence. I want us to talk about antimicrobial resistance. There has been rising antimicrobial resistance in Salmonella typhi, which is the bacteria that causes typhoid, and this is making treatment more difficult and adds urgency to the disease. Why is this trend alarming? And how does it shift the prevention conversation, particularly around vaccines?
Well, certainly the trends in antimicrobial resistance are alarming, and also the fact that we have very few new antimicrobials being developed that target diseases, especially diseases that are no longer present in developed or industrialized countries like typhoid. So essentially, this means that eventually some areas might have cases of typhoid that cannot be successfully treated with antibiotics, which means essentially a death sentence for those who are diagnosed. This is a terrible scenario and one that we want to avoid. And one way to do that is to introduce vaccination campaigns that would provide essential protection to populations against typhoid. And this would avoid the need for antibiotic use altogether in populations because you're preventing disease, or at least reducing the burden of disease significantly, such that when you do need to use antimicrobials, it would not be very common, it would be uncommon. And therefore, with less antimicrobial use, you're less likely to induce resistance of an organism to antibiotics.
So it sounds like there's still some work to be done. So let's look into the future. TyVAC, or the Typhoid Vaccine Acceleration Consortium, has been central in advancing typhoid conjugate vaccines globally. What role do you see TyVAC playing over the next 5 to 10 years as implementation scales up?
What we've seen recently that's very encouraging is that countries that are endemic for Salmonella typhi are introducing typhoid conjugate vaccines. And that's with the help of the Typhoid Vaccine Acceleration Consortium, as you mentioned, multiple collaborations and partners at the regional, national, and international levels. So TyVAC, we hope, will continue to advance these introductions in endemic areas, and a few countries are slated for those introductions later this year in 2025. We expect to help countries after they introduce to assess the impact of vaccination. How does it impact disease in these populations, helping them to measure that impact so that they can determine what the public health benefits are, and then look at needs for subsequent vaccinations in the future. And also helping to document how long this protection lasts in populations is another priority for TyVAC.
So, Dr. Lawrence, there are so many different interventions that can be used to prevent typhoid. But if you had a magic wand and could select one intervention that would be the most impactful in preventing typhoid, what would you choose to use and why would you choose it?
I think if I had my way to prevent typhoid in the areas and populations that are most affected, I would want a vaccine that could be administered as part of a multivalent vaccine, such that children, when they're injected with a single dose of vaccine, could be protected against multiple diseases, including typhoid. We know that such vaccines exist, and if typhoid could be added to that regimen, that would be wonderful to avoid multiple needle sticks in children. And also for that vaccine to have very long protection and 100% efficacy in prevention against disease that would ensure that a child would have a long and healthy, productive life free of typhoid.
It doesn't seem like that's an impossible magic wish, so hopefully that is something that is coming down the pipeline.
I'm glad you agree.
It was so great chatting with you, Dr. Lawrence, and learning about the typhoid vaccines and what's happening and what's going to happen in the future regarding typhoid vaccines and typhoid prevention. Thank you so much for joining, and we look forward to continuing the conversation in the chat.
Thank you so much. My pleasure.